Aqua is part of the NHS. We're a membership organisation of hospitals and commissioners, mainly across the northwest of England. The programme that I mainly work on is called Advancing Quality. We work with clinical teams to define clinical standards and then to measure against those to ensure that every patient gets the best care every time. There are approximately 7 million people in the northwest of England, and there are 32 acute hospital providers. So we're working with a lot of organisations across quite a wide geography. We needed to look for a different way of working effectively to bring all of those organisations together onto one platform where we could share a lot of our data and documentation to help people understand what they're doing well and to collaborate. We used to send out an awful lot of materials and documentation and things via email. There's one NHS, but effectively all of those hospitals operate as different organisations, each with different IT policies and email policies, and people's email boxes were getting clogged up, and it was just hard to work that way. We've been using Huddle for about 4 years now in the programme. Primarily we have 2 workspaces. One is for doctors, nurses, other clinicians, managers across the whole programme, across our region, for them to come together in their clinical specialties. They're sharing materials, they're sharing protocols about best quality care for their patients and spreading that best practice. The other workspace is primarily used by the core team here, the team that coordinate the programme across the region. Before we started using Huddle, we didn't have a single central repository where we could put all of our programme materials. It was a nightmare to find anything or to search for anything. Huddle's made that a whole lot easier. Often the team are out and about on different hospital sites, working in different places, and being able to access a central repository to continue our work when we're outside the office is really beneficial. We'd often be working on the same documentation, and document management, version control was sometimes quite tricky. Huddle helps us with some of those things because you can lock a document, it's very clear when someone else is working on it, and we've got the full change history as well. It's easy to go back to a previous version when we need to. Working in healthcare, then the security of our data and information is always going to be of importance to us, so it's reassuring that Huddle is based in the UK and that our data remains within the UK. 5-year forward view is the NHS's national policy for more personalised, more integrated, more joined up healthcare for the English population. Traditionally in the NHS we've had lots of information silos, but Huddle helps remove some of that by bringing down the organisational barriers and bringing people together from wherever they're working to improve care for patients.